Hello, and welcome to this special series on the roles and opportunities for pharmacists in diabetes care. I'm your host, Kirsten Yeld, the research manager at the Association of Diabetes Care and Education Specialists. Pharmacists can play a key role in helping to care for and educate people with diabetes, yet many don't feel comfortable in this position or don't know how expensive it can actually be. Joining us today is Jerry Meece, a longtime pharmacist and diabetes care and education specialist out of Texas. Jerry is well known in the diabetes world, serving in many national roles, and is a frequent speaker. He is a longtime proponent of pharmacists becoming involved in diabetes care, and we're excited to talk more with him about some key diabetes topics as they relate to pharmacists. Jerry, welcome.
Hey, thanks, Kirsten. Thanks for having me.
We are so happy to have you on, especially because we're talking about the role of the diabetes care and education specialist and the role of the pharmacist in diabetes care and education. And you've really been doing this, you've seen really the evolution of the pharmacist in this role over many years. And I think sometimes when we're talking about really maybe sometimes outside of the specialty or this profession, people don't really know how broadly the pharmacist works. You know, they think of the pharmacist in the community pharmacy, like in your CVS or your Walgreens, maybe sometimes in the hospital system, but they don't really know how broadly and how expansive this role really is, and really how important it is for people with diabetes. So I'd love to hear, you talk a little bit about the role of pharmacy in diabetes care and education.
Okay. Well, forever, I think, and if you go back to the early years of pharmacy, we were known as those guys that took pills from the great big bottles and poured them into the little bitty bottles. And it kind of resolved itself for that way for quite a while. And then pharmacy started expanding its roles. When I got into it, we really started trying to evolve into a much broader area, more or less what we were trained for. Pharmacists have always ranked high as a trusted healthcare volunteer, and we have multiple interactions with people of all chronic care and acute care cases in all various aspects. We are perfectly positioned, I think, in the healthcare provider field to do chronic care uh, consults between appointments with doctors and other healthcare providers. And while we're at it, uh, pharmacists should take this opportunity, and I can't resist putting this plug in to become, they're candidates when they should look at becoming more of a certified diabetes care and education specialist. That's kind of the end result of doing all this.
Well, what would you say? What can the pharmacist as a diabetes care and education specialist do today?
We could start if I were a pharmacist and saying, you know what, I want to get into diabetes care. I could start by just letting people be more aware of the new technologies. This is a dynamic field. New technologies evolve every day. Things from smart pens to smart meters to pumps to ways to treat blood glucose highs and lows. So just getting yourself up to speed on that would be a great thing. For example, I could also take you as a patient and say, let me show you how to get a better blood glucose sample. Let's do a finger stick on the side of your finger. There's more blood, there's less pain. We can keep your finger from getting sore. Just let me show you this, and I can demonstrate this on you in less than a minute. So, how do I get quick information from you and give information quickly to you? That's what I can do in the pharmacy care setting. We certainly should be teaching our patients about the signs and symptoms of hypoglycemia. A lot of the new drugs out there can really avoid a lot of this, but we need to help patients be aware that if this were to occur, here's the typical thing. So if I'm teaching you that, I'm also going to have what we call one pagers, handouts to you to just reinforce what I'm saying. Those things could all be done immediately today, starting right now.
Just hearing you talk about that role of the pharmacist and what the pharmacist can do, and it really is expanding this care team, right, for the person with diabetes. And I think lots of we've heard that idea so many times over the past several years, idea of the care team and the role of the diabetes care and education specialist on the care team. So really how important is that role, and how does a pharmacist really insert themselves into that care team, and how does that care team fit into the broader system?
Well, you know, Kirsten, we're in the middle of the perfect storm of healthcare right now.
Mm,
We
right.
have chronic care situations such as asthma, diabetes, hypertension, obesity that are coming over the gun whales at us. We don't have near enough people taking care of it right now. And not only that, we're having less and less people being in the diabetes care, for example, especially than we've had. That's flattening out. So, healthcare is looking at a time of immensely rising cost in healthcare. They're looking for situations and solutions, and pharmacists are perfectly positioned to take over a lot of that role as consultants and advisors in chronic care management of all types, but especially in diabetes. When you look at 34 million people with diabetes, 88 million people with pre-diabetes, meaning they're just outside of that. We've got a lot of people to take care of, and these numbers are not getting any smaller.
You know, I'm wondering as we try to picture this, is there any way that you can give us an example or can you tell us a story or say, like, hey, here's how the pharmacist, diabetes care and education specialist can really is really a link in that care team model?
Well, I think a good example is how we can more or less intervene in between what I call it in diabetes care, in a way that the patient sees the physician, they go through their normal conversations, and then they leave, and they come back, and what they've running into us, the first thing we see are things like uh, he said something about an A1C. I'm not sure what that is. He wants me to walk a mile a day, and I haven't walked to the mailbox and back in a year. So I'm not sure how to handle those things. And maybe one of the great things we're able to do as pharmacists in a quick consult manner is to explain what this jargon means. We, all those healthcare professionals, unfortunately, use it because we live this stuff, but being able to work with that and translate part of this and just get a better understanding of the patient to what their goals should be and what they're trying to do. Uh, we have a lot of different things that we can do in the quick consult area of working with patients.
Well, we've had many discussions about insulin affordability, which I am really excited to talk to you about, but I know we don't have time in this session. So would you be willing to come back and have another conversation with me about insulin affordability?
No, insulin is one big mystery from the start of how to inject it to how to get it paid for. And certainly, being able to unravel those mysteries is a whole nother conversation. I look forward to having that with you, Kirsten.
Awesome. Thank you, Jerry. So we'll talk
Hey,
soon.
thanks for having me.